Thank you all for joining. I just have a few announcements from the ISCE NAC chapter that you should see on your screen. And in the meantime, I will introduce our speakers today. So this is a webinar on the mental health effects of climate change, and we are honored to welcome Dr. Susan Clayton, Dr. Zhu from Emory, and Dr. Watson, who is from the Climate Care Center at Imperial College London. I'll let each of them give their own little intro and their background as they hop in, but that is the order we're going to go for presenters. So I'm going to hand it over to you, Dr. Clayton, to get us started.
Okay. Nope. All right. Am I successfully sharing my screen? I'm not seeing.
Yes.
Oh, okay. All right. Great.
You're in sort of editor mode still, but
How's that?
now we're seeing the notes side of the presenter view.
Okay.
So.
Okay. Sorry about this.
No problem.
Slideshow. There we go. Is that good?
Nope, we're not seeing anything now.
Oh, all right. Let me try this again. Well, let's see. That's so strange. Okay. Well, looks like I'm only being given the option to share my desktop, but I will just put up the. Is that working? Okay. Sorry about that. Okay. So thanks to everybody for being here. I want to give you some sort of overview of impacts of climate change on mental health, with particular emphasis on how youth well-being is being affected. And I want to start by encouraging us to think more broadly about this issue in a couple of ways. One is to think about the variety of ways in which climate change can have an impact. So this diagram, which you may or may not be able to see the details of, really illustrates a systems perspective on climate change. So you've got the outer circle. It demonstrates the actual kind of geophysical impacts, extreme weather, high temperatures, et cetera. But that in turn can affect the broader culture, things like loss of place, disrupted traditions. And those can also affect the population health through international conflict, migration, resource disruption. These can affect the actual community, people experiencing employment stress, housing stress, threats to the physical infrastructure, for example, from extreme weathers. And that can affect the microsystem, those social systems, aggression, family functioning, social relationships. All of those kind of accumulate to affect our mental health and well-being on the inside of the circle. So it's not just about, are we directly affected by storms, for example. And I also want us to think about the kinds of effects that can happen and what counts as well-being. So the title of the webinar is mental health, but I really define mental health very broadly to include sort of optimal functioning, social relationships, cognitive functioning, and so on. So extreme weather, for example, can not only increase mental health problems, and we know that happens, but it also tends to increase domestic violence. And particularly relevant to children, it disrupts schooling and social networks. Chronic changes have been less well studied, but there's increasing recognition that higher temperatures have significant impacts on our mental health and well-being. The rise in big data has allowed us to observe that higher than usual temperatures are associated with increase in suicide, psychiatric hospitalization, aggression, just increased negative mood, and decreased air quality, which is also part of climate change, is associated with increased cognitive and functional impairment, likelihood of dementia. And again, this research is fairly recent, but is rapidly accumulating. Just briefly, why is climate change associated with decreased air quality? Well, I've highlighted here fine particulate matter. I think everybody has some sense of the increased incidence of wildfires, and fine particulate matter is very much a consequence of wildfires, but also the burning of fossil fuels. It decreases air quality. Warmer temperatures keep more air pollutants closer to ground level. So yes, decreased air quality is part of climate change. Now, if we think also about the larger social context, climate change actually interferes with normal social behavior. Partly, people are just less likely to hang out outside talking to their neighbors if it's too hot. There are instances where the environment no longer supports interaction. For example, in far north communities where uh, unreliable winter ice makes it difficult for them to visit each other. There's also some research showing that thinking about climate change enhances suspicion of outgroups. And of course, when people have to migrate, when people are displaced because of climate change, their social networks are disrupted. And then a lot of the indirect impacts of climate change, especially the economic impacts, increased food insecurity, those are known to impair mental health as well. So I said I wanted to highlight children. Children are more vulnerable for a variety of reasons. Certainly physiologically, the developing brain and nervous system are more vulnerable uh, to impacts that might have a long-term impact, a long-term effect. They're less good at regulating their body temperature. There are role differences. They're more dependent on other people, so they're kind of susceptible to vicarious influences of climate change. They don't have access to the power and resources that adults have, so they're kind of um, more vulnerable uh, to the disruption of things that are affecting them without the opportunity for them to have control over those things. And then, of course, the possibility, because they are developing not just physiologically, but emotionally, cognitively, psychologically, these disruptions to schooling might have permanent impacts on their learning over lifetime. These early traumas can permanently disrupt the ways in which, or change the ways in which they deal with stressful emotions, for example. Preterm birth is a very obvious way in which children are vulnerable. Both extreme weather events and high temperatures increase the likelihood of preterm birth, which is a known risk factor for neurodevelopmental problems later in life. Meanwhile, and I didn't introduce myself, sorry, but one of my personal interests is people's emotional responses to climate change, and particularly their climate anxiety. And I took this headline from a newspaper a few years ago to illustrate that people are feeling more anxious. Here are some quotes I've heard from climate activists, youth activists, talking about feelings of panic, impaired eating, feelings of paralysis. Uh, this clearly, for anybody interested in mental health, begins to sound like a significant mental health problem. So with my colleague, Brian Carazia, I developed a scale to measure climate anxiety because anxiety can be adaptive, right? Anxiety is a signal that there's a problem we need to pay attention to. But when it overwhelms our resources, we can't sort of function, then it can become a threat to mental health. So our scale looks at things like, do people say thinking about climate change makes it difficult for them to concentrate? Do they say it makes it difficult for them to have fun, to socialize with their friends? And an overall climate anxiety score is significantly correlated with clinical measures of depression and anxiety. And this has been found to be true in many countries around the world. If you think about who is worried, well, really the short answer is that everybody is worried. In this graph, you can see that 45% of a sample of 10,000 people around the world said that their ability to function was threatened by their concerns about climate change. Young people seem to be particularly impacted, as are people who are at greater risk. And if you look at this chart closely, you can see that there's greater impact in Nigeria, India, and the Philippines, which are more strongly affected by climate change. Some recent data that are close to home for those of us in North America, and focused on younger people. 95% of them said they were worried. In Canada, 87% said they felt, I don't know what mild hopelessness is, to be honest, but it doesn't sound like a good thing. A more rigorous assessment using the climate anxiety scale found that 28% of adolescents who were in an emergency room were reporting climate anxiety. And this matters not just because we care about people's well-being, but because their distress about climate change can really involve issues of identity, who they are, what they feel capable of, what kind of possibilities they can envision, existential meaning, and so on. And here's a quote from Frances Burgunst and Helen Berry that just says, reminds us that if climate change is undermining the mental health of our children, it's undermining the future of society, right? Because those are the people who are going to be society in a few decades. So one thing to consider with regard to this age group is they are making decisions that are going to affect the rest of their life. They're deciding whether to get married, whether to have children, what kind of career to pursue, what kind of education to pursue, and just general life goals. And some recent research has found that people are saying, yes, their climate change is affecting their decisions. In fact, I report here the result of a survey, 69% saying climate change will influence where I choose to live. But another source of validation is that the real estate company Zillow has started reporting the climate vulnerability of its properties because people are taking that into account as they make housing decisions. So so young people are vulnerable. They are being affected. We need to help them. And I know that my fellow presenters are going to pursue this more, but I just want to say that we can help children with their short-term responses to cope with anxiety by teaching them coping skills, such as cognitive reframing, just sort of standard skills. Think about the problem differently, learn how to detach. Learn how to manage your own emotions, recognize your triggers, learn techniques that will allow you to reduce your own stress level. But we also need to think about long-term responses. And one reason for concern is that children and young people who are focused on addressing the problem of climate change, could also develop more negative emotions as they think about it more, and they feel more helpless because their actions are not, I don't get up one morning, say, I'm going to fix climate change today, and then tomorrow it's all gone. So we need to, in addition to encouraging young people to address the problem, enhance their strengths, their emotional and social strengths that will enable them to do that, including their self-regulation abilities, but their feelings of efficacy and their feelings of connection to other people. And I want to highlight that a lot of young people report being dismissed or ignored when they talk about their fears about climate change. They report being particularly frustrated by the lack of governmental response, and this is true around the world. So to support them, we need to accept their anxieties as realistic, help them avoid overexposure, and help them kind of construct their own guidelines and boundaries to maintain emotional well-being, but also set up community programs, places for them to meet and talk and perhaps take action. We need to address policies at the societal level so they'll feel that climate change is actually being addressed by those in charge. So really, if we want to promote resilience and adaptability among young people, We need social change that does more to acknowledge that climate change is a problem. Um, we can deal with it through healthy urban design, through greater education, and through greater support for mental health systems. And I think that's my last slide, and we're going to be taking questions at the end. So thank you for listening.
Thank you so much for that. It was really great intro to this session. So yes, please, if you have questions, put them in the chat. We will take questions all together at the end. And now we will hand things over to Dr. Zhu.
Hey, can you hear me all right?
Yes.
Good, good. And can you see the slides?
Yes.
Oh, okay, so let's get started. And hi, everyone. I am Qingyang Zhu, and I'm a current postdoc at the Rollins School of Public Health at Emory University. I've been working on mental health challenges associated with wildfires and other natural disasters for a couple of years. I'm very happy to have this opportunity to talk about how disasters are affecting populational mental health in the era of climate change. This is actually my first time giving online live talk to the global members of ISCE, but I've done this a couple of times offline. I feel like there's a need to spread the message to the global community because climate change is a challenge that we are facing together as human beings. It is extremely important because the whole world is breaking apart, but we're still facing this challenge together. Living in the 21st century, we have witnessed or even personally experienced many devastating natural disasters. Take myself as an example. I was born and raised in East China, and then I moved to the Southeast United States before the pandemic. So far, I've spent the majority of my life living in subtropical coastal regions, which makes me kind of an expert in dealing with hurricanes. However, I have no personal understanding of wildfires, even though I've been working on this topic for a while. To be honest, I still don't know how to get myself ready if I happen to encounter some kind of wildfire event in the future. I might feel more anxious facing a moderate wildfire than I would during a major hurricane event. I believe that most of us share a similar experience because climate disasters appear in very different phenotypes. It is unlikely that any individual can experience all types of them in their lives, but it is also equally unlikely that this person never experienced any of them. Because extreme events are becoming more and more frequent in the era of climate change. Some disasters may seem to be uncorrelated with each other. People may find it hard to figure out the association between droughts and extreme rainfalls, but they have a common driver, that is climate change. I think people nowadays are familiar with the word El Nino, or even the more accurate term, El Nino Southern Oscillation, which is ENSO. It is actually not a harmful thing as it appears to be, because it's a key component of the global climate system that influences the redistribution of heat and rainfall in the tropical Pacific Ocean, and then it will affect the global climate. The real problem is that ENSO is becoming more and more intense or more polarized due to climate change. So the original balance of heat and rainfall is being disrupted. So that's why you will see drought and extreme rainfall happening at the same time, but in different regions. And the changing climate is not making natural disasters more frequent, but also more severe. Data from the United States show that the number of disasters costing more than $1 billion of US dollars is rapidly increasing. And more importantly, financial losses measured in US dollars does not capture the full extent of the impacts, because, especially in the low-mid-income countries, if you try to measure the financial loss due to a major hurricane in the Philippines, you're likely to get a smaller number than you would have in the United States. That is because property and healthcare costs are much higher here, but human lives are equal everywhere, and that cannot be measured by money. And there are some positive things in the modern society because we are kind of having an improved healthcare and agriculture system, and also globalization helps us to redistribute food and also support throughout the world. But mental health, the burden associated with mental health is increasing. And the association between, more importantly, the association between climate change and mental health can happen through multiple pathways. And here I would like to mention some of the well-recognized pathways that underlie the mental health impacts of natural disasters. The first one is just like Susan just mentioned, is the anxiety about the unknown or climate anxiety. This may happen as short-term effects or long-term effects. So sometimes when you're not sure if a hurricane or wildfire may ultimately hit your community in the next few days, and that's a short-term effect. And sometimes you're anxious about whether future extreme events might happen more frequently and that will ultimately disrupt or even destroy people's lives. And these are the long-term climate anxiety. And the second, disasters may impact the living environment, and sometimes temporarily, sometimes permanently. This is more important for people who are auto workers or who have multiple part-time jobs to support their lives. And third, the aftermath of major losses can mean a lot among the survivors. And last but not least, disasters often involve some co-exposure to other environmental stressors, such as air pollution from wildfire smoke, from drought or extreme heat, which can further exacerbate mental health burdens because they are stressors per se. Sorry. And also, based on these pathways, I would like to briefly summarize some research findings on climate disasters and mental health disorders. So the first research actually comes from myself. We identified the long-term association between wildfire smoke, the short-term association between wildfire smoke events and ED visits for anxiety disorders in the Western United States. Our findings show that wildfire smoke may worsen anxiety disorders not only through a heavy dose of PM 2.5, but also through the visible smoke plumes. So sometimes people see the plumes, which makes them more anxious than you're actually exposed to the PM 2.5 itself. And more importantly, there are some vulnerable populations, such as females or older adults, who are disproportionately affected by wildfire smoke. And natural disasters may also cause some issue among people who are currently not living with mental disorders. So in this case, exposure to disasters may lead to the onset of certain conditions such as depression, anxiety, and bipolar disorders. This effect can be seen for a long time after exposure, so it can be either 6 months or years. You will still see an increase in the onset of some mental health conditions. And also, an often neglected part is the chronic exposure to disasters, because people may see disasters as acute exposure, they happen and they're gone, but actually the chronic exposure can happen in multiple scenarios. For example, exposure to wildfire smoke may happen throughout the year. It's also primarily due to the long-range transport. For example, wildfire occurred in Canada may cause worsened air quality in the United States, and that may last for months and even longer. And additionally, people are still considered exposed to a climate disaster if the consequences have not been well compensated. For example, if people suffer from major property loss and that has not been compensated during the January 25 LA wildfires, you're still considered to be exposed to this climate disaster, especially in terms of mental well-being. It is also important to study the mental health service after exposure to a disaster, because some urgent mental health issues can be mitigated or even prevented if proper healthcare service is in place. However, it is very possible that people with urgent mental health need might miss an appointment during some of the major climate disasters and that can make things even worse. So from the current research, we can summarize that natural disasters are actually associated with mental health disorders through multiple pathways. And this can happen as short-term effects or long-term effects. And disasters are actually social amplifiers that makes the vulnerable population more vulnerable. For example, I work as a researcher. I stay indoor for the majority of my work hours. So I'm actually less vulnerable to hurricane or wildfires than the other workers, or than people who have multiple jobs. Also, it is not only about the mental health conditions themselves. Mental health service after disasters is actually critical to protect the populations in need. So that brings something that need to be done in the future. So the first one we need to think about if the risks are actually preventable. They are actually preventable, but it is important to study how to prevent the mental health risk. If you can prevent the mental health risk at the very early stage, you have a very high long-term benefit. And also, it is also important to study whether the mental health vulnerability will further lead to other adverse health outcomes. It is so some study report that people with mental health conditions are twice as likely to die than people who live without mental health conditions. So that's for the all-cause mortality, not only suicide or some other mental health related mortality, but that's from all other systems. So people with mental health conditions are generally more vulnerable to other types of diseases, and which may ultimately be the cause of death or the major cause of the disability adjusted life years among this population. And it is also possible to use modern AI techniques to predict the healthcare needs before and after the climate disasters, which help us to rearrange the resource needed to protect the vulnerable population. And it is also possible to improve accessibility of mental health service and potential solutions through kind of modern language models. Nowadays, I believe young people tend to reach out to things like ChatGPT for help than they would to some like others like offline resources or by like a helpline cost. I think they're kind of rely on more on this kind of chatbots. So there's an opportunity to implement some kind of climate solutions in this chatbots to make them more climate change compatible. And that's all I have for the research. And last but not least, I would like to spend some time to acknowledge my colleagues and to kind of introduce our group. We are a multifunction team at Emory that works on both the exposure aspects and the health effects of air pollution, climate change, and natural disasters. And here's a link to our website if you want to scan it and get to know our research better, or if you want to find any opportunities to collaborate in future research projects. Our main research is actually carried out in the United States, but we do have projects throughout the globe. We help the teams in Africa and Europe and in China to establish air pollution models and climate models and to help them run their local epi analysis to support the local community. And you can also find my email address and the email address of the PI here. Okay, that's all I have.
Excellent. Thank you so much. And now we will hand it over to Dr. Watson.
Thank you. I'm just attempting to share my screen. Can you let me know if you can see it?
Yes, we can see it.
Awesome. Thank you so much for having me. I'm Daniela Watson. I'm a health psychologist and research associate at the Climate Care Centre based at Imperial College London in the UK. And for those who don't know, the Climate Care Centre, we exist to provide evidence on the interchange of climate change and mental health, and to translate that into policy and into practice. And that leads me on to the title of my talk, which is Climate Change and Mental Health Interventions and Policy. And luckily enough, the two previous speakers have been great at kind of giving the background of climate change and mental health, so I don't have to repeat too much. But I will share our recent paper that got published, I think last week, so hot off the press, just kind of giving an overview on what we've heard from the last two presenters of what's going on for climate change awareness in young people. That was the focus of this narrative review. We reviewed 93 papers and had 46 experts in consultation to map out what young people are experiencing with climate change crisis, and we found 173 different terms in how young people explain or describe or feel their experiences of climate change awareness. And our figure on the right is our interpretation of these 173 terms that we've tried to map out into 6 kind of domains, which are the affective responses, the cognitive responses, behavioral responses, socio-ecological health, resilience and adaptation, and impacts on mental health disorders. And then within there's lots of subcategories. And I guess I'm just showing you that to kind of show how broad this topic is. And we also found 52 ways that young people were describing how they were coping, the strategies that they were using. I also wanted to bring your awareness to the 41 definitions of eco-anxiety that we found from all these different papers, from 43 different paper citations as well. So this field is conceptually a lot is going on, and I guess one of the main points from this paper is that we need to both work on how to conceptually organize this field, but also at the same time, with the urgency of the climate crisis, work on the actions. So the rest of this presentation will just be thinking more about the actions in terms of interventions and policy actions, but to acknowledge that we also need to be thinking about how to conceptualize and measure all of these different terms effectively. So what interventions currently exist for climate change and mental health? Colleagues at the Climate Care Centre, led by Siki, found 37 interventions in their review which address climate-related mental health. Only 9 of them were scientifically evaluated, 2 being with young people. An additional 16 were found in the grey literature, 5 of them targeted young people. And similarly, there was a review published this year on climate cafes. And for those who don't know what climate cafes are, in a very simple sense, it's a space where people, but a lot of time it's young people, are coming together to share their experiences and feelings and sometimes actions around the climate crisis. And there was no academic literature found on climate cafes, but there were 41 records in the grey literature. Also to acknowledge that the World Health Organization Europe and the UK Health Security Agency, who are part of the UK government, also put out a call in January to collate case studies on climate change and mental health interventions, and we're awaiting their reports, hopefully this year. There's a lot of, I guess, traction on what's happening in this space, but there seems to be not enough evidence going on. So one of the things that we are doing at the Climate Care Centre is evaluating interventions that already exist. So I'm going to give you 2 examples. So our first example is working with the youth-led organisation, the Resilience Project, who started about 5 years ago, led by Katie Hodgetts, who developed an 8 to 10 week programme called Resilience Circles, where they train young people to be co-hosts or kind of youth leaders, where the young people then provide a space for other young people each week to discuss the climate crisis, practice resilience techniques, talk about burnout, and also action, and basically creating a lasting community of care. And we were brought on board as evaluators of this programme. And we worked with the Resilience Project Board of Youth, so we had some youth advisors guiding us on how to do the evaluation, just to ensure that we were using methods that were reflecting young people's experiences. So we actually did surveys and audio diaries, focus groups, and guided journal entries with the young people in this programme. And what we did find is shift towards positive emotions such as hope, joy, and people being more engaged after they were part of the resilience circles and reporting fewer negative feelings. On the next slide, I'll also mention the mechanisms that we think this resilience circles work, but also to acknowledge that this project was chosen as a case study for the UK Health Security Agency and the World Health Organization Europe's case studies that I mentioned earlier on the previous slide. So the mechanisms of change, and I think it's important to think about this because I know the previous speakers were kind of acknowledging what things work. So in the Resilience Project, we identified that normalizing eco-anxiety and validating that it's a normal experience for people who understand what's happening with the climate crisis, and putting words and names to it was really important, and having that validated by other people having similar experiences and having that shared community care. Also reframing what it means to be a climate activist. It doesn't have to be people who are just protesting and giving their lives to everything, but it can be people doing small actions and also people having time to rest to sustain them in their climate actions. Also fostering a deeper relationship with themselves and healing parts of themselves that need further support and care. cultivating a sense of agency so they can continue doing their climate actions, and also embracing intersectional perspectives within this program, because many of the young people came from different countries and cultures, from different identities, and actually that was a big strength to having this shared hope and different ideas and perspectives coming together. I just want to read the quote from one participant saying that the Resilience Circles was a beautiful community that I looked forward to every week and made me feel so safe and loved and understood. It would be a value for anyone, as it would allow anyone to receive such love and support, and very much help improve anyone's mental health. I'm just going to give you another example. We're again working with a youth-led organisation called EcoMine, this time in Australia. And this is part of our Rising Faster Than Sea Levels project, where we conducted group discussions with young people in Australia, the Philippines, and Trinidad and Tobago, but focusing on the Australian context. Young people were telling us that they are feeling the effects of climate change and their mental health is being impacted. And what they really want is to learn more about, they want young people to learn more about what the impacts of climate change are. They want spaces to talk about what's happening in the world, and they want government and corporate action now. So what we've done is worked with EcoMine, a youth-led organisation, to co-design with youth advisors as well, a youth summit which is happening on the 20th of November this month. And it's structured in three phases of the day, which we're naming the heads, hearts, hands, where we're doing a climate literacy morning, which is a climate fresh, so young people can learn more about the climate impacts. Then we're holding a space where young people can process emotionally what they've heard from the climate impacts and talk about how they're feeling. And then we're having an action part where we're having the young people co-design a youth declaration with us, so they can express how they're feeling and what their needs are and what they demand from the governments and corporations. And we're working with UNICEF in Australia and also Plus Climate Journal to organise a think table bringing together decision makers and young people after the youth declaration to hear both sides of the story and think how they can work together. And hopefully this will implement COP31, which is still proposed to be in Australia or Turkey. And another part of our work, led by my colleague Jessica Newbury-LeVay, is thinking about how we support young people going through education and learning about the climate impacts. So the Compass project that Jess leads, she's been working with young people in schools and universities and educators to hear how they best think we can psychologically support people learning these really hard-hitting subjects, because educators are saying that they don't really know how to teach what's going on without distressing people. And we're hearing from, I know there's stuff going on in the US, but also in Australia, where they're trying to remove climate education to prevent climate anxiety happening in young people, which we don't think is the right move. We just need to think of ways to embed the curriculum in a safe way. So that's a big part of what we're doing at the Climate Care Centre right now, is thinking of ways to embed climate literacy in psychologically safe ways in the curriculum. And pivoting a bit to the policy side that we work on as well, we did a big review of national adaptation plans and found that of 193 countries, only 42% of countries mention mental health in their NAPs. This means that 58% of countries do not mention mental health at all in their national adaptation plans. Only 36% mention the actual impacts of mental health, and only 17% mention any kind of actions about mental health. So really, we need to be working harder with our national governments to make sure that mental health is included in our national adaptation plans. And one of the ways that we're doing this in the UK, because the UK aren't doing that great either in this, is we're working with the King's Fund on a cross-government collaboration, uniting 13 of the UK government departments to break down the silos and really align the two kind of sometimes opposite climate change and mental health silos, bringing them together. and talking about how we can design policies and interventions in the UK. And the big thing at the moment we're thinking about is what evidence from researchers do they need to change policies. So that's one way we're doing this. And then really currently, again, Jessica Newbury-LaVey is currently in Berlin. She's at the Conference of Youth, I think, right now, co-leading a workshop on centering youth mental health in climate action. But we're also, for the last 5 or so years, been at COP representing mental health. And this year we've been chosen through our Connecting Climate Minds project in one of the activation groups. So we're again trying to promote the mental health side of climate change at the international level too. Key takeaways, I guess, from this presentation, we can design interventions, but maybe some low-hanging fruits is partnering with community and civil societies who are already doing programs and evaluating those programs. Also working with local, national, international policymakers to ensure that mental health is included in the climate change agenda. And I guess a question just generally to you, and what I've been thinking about a lot, is how can we translate our research into policy and practice? And also our interventions, how can they influence policy too? Thank you so much. That's the end.
All right. Well, thank you so much to all of our speakers. I think you collectively did an excellent job of sort of covering the spectrum of measuring climate anxiety, looking at mental health associations with specific climate events, and then all the way to intervention strategies and policy change. So now I'd like to open it up to anyone who has questions. I think you can either put them in the chat or, raise your hand and unmute yourself. I can get us started if we don't have any initial takers. I did want to ask, Dr. Clayton, you had mentioned that in one of your earlier slides that heat exposure increases suspicion of outgroups. And I was just wanting to hear a little bit more about that, if you could.
Sure. Yeah. Sorry, there we go. Trying to see some faces on my screen. Yeah, this has been research, and I'm afraid I don't, at the top of my head, can't give you the name of the researchers, but there's been a few studies that have looked at priming people essentially with thoughts about climate change. So very sort of classic social psychological methodology, and then finding increased negative attitudes towards outgroups, sort of decreased willingness to interact. So yeah, I think it's interesting research because not a lot of people have been looking at that. But I think it's what might be described as a sort of circle the wagons effect. When you feel under threat, you're more focused on protecting the values and needs of your own in-group, and you become more hostile towards out-group members as potential competitors, which is unfortunate since, of course, another possible response is to have this sense of solidarity as we're exposed to collective threat. But at least in these studies, that's not what happens.
Yeah, it's interesting, and especially thinking about, as people do need to relocate even more as these climate disasters happen, it becomes even more of a problem.
Absolutely.
Okay, we have some questions popping up in the chat, so I'll just go ahead and read them. The first is, as a general question to all speakers, I'd appreciate advice how to produce policy implications from or within your research articles.
I can start if that's helpful. I mean, this is something that takes time, and also, it takes time to develop those relationships and even get an in the first place. But working with policymakers from the outset, so you're developing findings that they can actually use. And I think I'm mainly a qualitative researcher, but I've acknowledged in the last couple of years that numbers and stories is what I'm hearing they want. So I'm now kind of pivoting slightly more towards those mixed method findings, because that's what I'm hearing from policymakers. That's what they want. So I guess my answer would be, if you can. Like I say, it does take time, and knowing the right people and working on those relationships is working with policymakers. And when I say policymakers, they can be local, national, or international, at all levels. And I think starting especially with the local, who know their communities and they can be gatekeepers to participants, etc., is really helpful. But I'll pass on to the other speakers.
Yeah, I'll just jump in briefly just to emphasize and underline what Daniela just said, that we need to be willing to talk to people. We need to try to have our voices included in policymaking groups. This might require thinking about the kinds of research methods that are going to be more compelling to them. For example, I'm trained as a sort of traditional social psychologist, and when I was being trained, our samples were very small, and there's a lot of good statistical reasons why you can be fairly confident with a sample that's not that big, but policymakers like to see big data. It's more compelling to them. So learning the methods, learning the language, learning when we think about our research questions, to think about possible applicability as maybe one criterion. So there might be some really interesting relationships we could uncover, but they're very difficult to translate into action. So I'm not saying, I 100% believe in basic research, but if you do want to make a difference, think about the kind of research that actually might have clear policy implications, for example.
Okay, I think let's move on to the next question. Let's see if I can just summarize it a little bit. There's many existing mental health services, and so they're wondering, to what extent is climate already integrated into those current mental health services, and how are mental health professionals being trained about climate, and what are the challenges and opportunities?
Okay, I have something to share. I try to catch up with the progress after my paper is published, and find that the legislators in California actually put together a bill that to offer kind of free mental health counseling service to wildfire victims in a year or 2 years after post-exposure. So they actually offer free counseling service to help people recover from their mental health crisis. So they're actually, policymakers are actually paying attention to research output, and it also matters that the level of population your work is about. For example, if your work is about the local community, ideally you find some local collaborators to give you some actionable suggestions. But if you're working on some global studies, you're paying more attention to the big picture. Yeah, but generally, as people, I think people in the School of Public Health generally need to work with people from other fields like economics and sometimes even policy and law, to make sure that your research has some real world impact, and this matters. It's not only, I think public health is not only about identifying the risk, the association. We need to put this like a step further. Yeah.
No, I'll add a resource to the chat. I wasn't involved with this, but the British Association of Behavioural and Cognitive Psychotherapies have just released a guide on eco distress and climate anxiety. I can put the link in the chat, but I've skim read it, but I'm not involved with it. But that's a really good resource. So.
Yeah, and I'll say there's still quite a lot of room for this to be integrated into mental health training, but people are beginning to think about it more and more. And in fact, the American Psychological Association is having a continuing education webinar on November 19th about information for primarily clinical psychologists to be aware of as they think about climate change.
Excellent. Let's go to Felix for a live question.
Yeah, okay. If that's okay to ask a live question as well. So yeah, the question is based sort of on just anecdotal observations, but I think that up until a few years ago, there was sort of a success story to be told around the mental health effects of climate activism. And I felt like, okay, I personally observed it, but also talking to other people, okay, if you engage in climate activism, it makes you feel good. There are some successes that you see. You have good social interactions along with it. And talking now to activists or former activists, I feel like this doesn't quite hold up anymore because there's this sense of perhaps we're not winning and perhaps it will be catastrophic. And I wonder whether you it makes it hard for me also to still tell this story. It doesn't feel quite right anymore. And I wonder whether you observe the same, whether what do you think the research points to looking at this, and what's your story around this these days, if that makes sense.
Yeah, I think we need a lot more longitudinal research because, like you, I'm aware of that relationship, but have also a sense of what it's like to be an environmental activist over the long term and face the lack of impact and so on. What I've seen suggests that certainly it depends partly on that sense of not just self-efficacy, but collective efficacy. So if you can maintain that, that might allow the behavioral engagement to continue to be associated with positive emotions rather than with negative emotions and burnout. But and then social support is a big issue. So yeah, we need a lot more research to really understand the relationship there. But to be aware, I think it's sort of ethically required that we don't just assume that activism is always going to be good for you. We need to be aware of this potential burnout and negative impacts.
And I also add, because I think this also might answer some parts of Clara's question in the chat, that I think it's a really good question. And with the Resilience Project, Katie Hodgetts, who created the Resilience Project, she came from burnout as a climate activist and wanted to provide a program to support people. But in that process, and one of the reasons she wanted this evaluation was she was realizing that training young people to be climate leaders also has this downfall effect as well, right? Like you were mentioning, Felix. And actually, what we found with our evaluation is that we found that after they went through these resilience circles, lots of emotions were really positive, but actually, through the emotions, negative emotions actually increased. And that was concern, anxiety, and exhaustion. And we think that's because, well, we spoke to our board of youth, the youth advisors, what they think might have happened here, because we were quite surprised. And they think that the young people went through this really wonderful bubble of support and community support, but they came out the other side and realized the world hadn't changed and it's still awful out there, and coming out and realizing that still is really hard hitting. So yeah, I think it's really good that we're mindful of, I guess, the detriment of being a climate activist and also the detriment of our interventions at the same time, and thinking of ways that we can, I guess, make interventions that are even more supportive. And I guess one thing I just want to acknowledge is that I've spoken to a few people in this field who think their interventions are always going to bring the best for people, but I think we need to just be really balanced when we're designing interventions and evaluating interventions, that they might also have these negative effects, and that's not always a bad thing. There might be a reason behind it, but we need to be really consciously evaluating that objectively.
Thank you.
Yeah, great. I think we covered Clara's question as well in the chat. So the last question that's in the chat is specific to drought and whether you've seen research about drought and mental health, and whether it affects any specific population, in particular, potentially agricultural workers.
Well, to be honest, I'm actually not very familiar with drought and mental health. But from my experience. And in the extreme heat, rainfall, wildfires, and mental health, I found in general, beside the youth population, females and older adults are generally more vulnerable to the mental health impacts of natural disasters. For females, it is likely to due to some hormonal issues, because the metabolism is like kind of the biological stuff is different in among males and females, so that makes females in generally more vulnerable to mental disorders, especially associated with acute exposure. And also, it is often neglected that older adults have their mental health needs as well, because their voice is not it is hard for people to hear from older adults. They're not as active as young people in social media, but they actually have a strong need of mental health service because they're physically more vulnerable to any health conditions, and this will ultimately link to mental health. So any health conditions can cause mental health among older adults, and mental health can cause other health conditions among them as well. So that's kind of, they have a cycle, and that need to be paid attention to.
Okay. So there's some other sort of comments in the chat. Doesn't look like questions, but I think we're just about at time anyway. So I would like to just say thank you so much to all of our speakers. It's been really excellent hearing about your work. And I'd like to remind everybody that the last webinar in this series of 3 webinars is happening on November 24th. And that will be about climate change risk communication. So we hope to see you all there. All right. Thank you so much.